I'm at Box Hill Hospital in Melbourne's East on a Monday night shortly before 7:30pm. As you can see, there are plenty of ambulances parked behind me. There are about 10 here at the moment, and many have been waiting here for hours. I've seen patients go into a room and wait on stretchers to be seen. Paramedics say that the issue is a lack of beds and staff to offload patients in the hospitals.
We've spoken to crews that have been ramped, they're ramped for 13 hours, their whole shift, and sometimes not just looking after one patient, looking after several. But it's pretty routine, and one of the crews said they just spend more of their shift sitting around hospital rather than out there responding to cases in the communities.
Ambulance ramping is a problem that's plagued hospitals for more than a decade. It involves patients waiting on stretchers to be admitted to hospital, sometimes for many hours, with paramedics by their side. Experienced ambulance officers say the problem has never been so bad.
Well, some of these patients are ones that need immediate care straight away, and one of the micro crews we spoke to, they had notified the hospital ahead of time that they were coming in with quite a sick patient, and another ALS crew said they were coming in with a stroke patient. So that's where you would typically have a rapid offload occur the moment the crew arrived, but even those patients were waiting on stretchers for 2 hours or so, even to the point that some of the crews have been asked to do blood tests for the patient, which is not normally in the skill set of the paramedics. They would normally be up to the nursing staff, but those duties normally performed by the hospital themselves are falling onto paramedics.
Paramedics have spent more than 523,000 hours waiting at emergency departments across Victoria over the past 5 years. That means they've lost 120 years' worth of shifts over the same period. New data The Age has obtained through Freedom of Information paints a bleak picture. Ambulance ramping is a problem because when paramedics are stuck waiting, it means they can't return to the road to help other sick Victorians. Meanwhile, patients who've suffered heart attacks and others get sicker as they languish on stretchers in hospital corridors. It's estimated the ramping crisis has cost Victorian taxpayers around $105 million in wages over the past 5 years.